Now let's start talking about the lower lung lobe segments. The first segment is the superior segment. The superior segment starts to appear when the trachea starts to bifurcate. The superior segment will appear. Then it will disappear when the heart starts to appear because it's the most superior segment of the lower lung lobe. Then will come the basal segments of the lower lung lobe. The basal segments of the lower lung lobe are PLA plus M, PLA plus M, PLA plus M. Posterior segment, lateral segment, anterior segment, and medial segment. So it's PLA plus M. However, on the left, it's PLA M, PLA M, PLA M. Posterior, lateral, anteromedial. Anteromedial share the same segment, so it's anteromedial segment, PLA M. Then, at the most inferior aspect, it will become PLA, 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 PLA only. Posterior, lateral, anterior. Posterior segment, lateral segment, anterior segment. Posterior segment, lateral segment, anterior segment. Now let's start talking about the segmental bronchi to the right lower lobe. As you know, the right mediastinum bronchus, after it gives its first branch, which is the right upper lobe bronchus, it becomes bronchus intermedius. Now, this is the bronchus intermedius, which is the second division of the right main stem bronchus after the right upper lobe bronchus. Now, the bronchus intermedius has given the middle lobe bronchus and the right lower lobe bronchus. Now, the right lower lobe bronchus is giving its first branch to the most superior segment of the right lower lobe, which is the superior segmental bronchus. Then the right lower lobe bronchus, after giving its first branch, it will become truncus bizalis. Now, this is the truncus bizalis, which is the second branch of the right lower lobe bronchus after its first branch, which is the superior segmental bronchus. So this is the truncus bizalis. Now, the truncus bizalis will give to the basal segments of the lungs PLA plus M, segmental bronchi, posterior, lateral, anterior, medial. So this one is posterior segment bronchus. This one, lateral segment bronchus, lateral segmental bronchus. This one, anterior segmental bronchus. And this one, medial segmental bronchus. Two PLA plus M segments. PLA plus M segments. Posterior segment, lateral segment, anterior segment, and medial segment. Remember, the medial segment is always stuck here, okay? So let's start talking about the bronchosegmental anatomy to the left lower lung lobe. So here, this is the left mediastinum bronchus. The left mediastinum bronchus will give left upper lobe bronchus and left lower lobe bronchus. So here, this is the left upper lobe bronchus and this is the left lower lobe bronchus. The left lower lobe bronchus will give its first branch, which is the superior segmental bronchus, to the superior segment of the left lower lobe. Then the left lower lobe bronchus will become truncus bizalis. So the truncus bizalis is the second branch of the left lower lobe bronchus after its first branch, which is the superior segmental bronchus. So now this is the truncus bizalis. Now the truncus bizalis will give the PLA M segmental bronchi to the PLA M basal segments of the left lower lung lobe. PLA posterior. So this is the posterior segmental bronchus to the posterior segment. then the lateral segmental bronchus to the lateral segment, then the anteromedial segmental bronchus to the anteromedial segment of the left lower lobe.